Okay, our last case, Traci H. Traci is a 10-year-old African-American girl, neatly dressed and groomed, and appeared quiet but cooperative during the interview. She lives with mom and stepdad in middle-class neighborhood. She attends elementary school where she's enrolled in the 5th grade. She normally has good grades. However, the last quarter, her grades have slipped. She's concerned that Traci has become more withdrawn, her mom is, and is not interested in the same activities that she previously enjoyed. She's also not interested in the same girls. So, just friendship-wise, some things kind of change there, which is unusual for girls in the 5th grade that have been kind of stable up until now. She is experiencing nightmares, sleeplessness, complains of stomach aches and headaches. She's also shown a preoccupation with clothing, grooming, and weight. To me, all of this is starting to sound a lot like bullying and or potential abuse. So my spidey senses are kind of up. She's having nightmares, which if she was just having a regular eating disorder and kind of going through teenage issues, nightmares are not usual. Nightmares are much more typical for something traumatic. Bullying and or abuse fits a lot more into that. She's having difficulty sleeping, and she's having a lot of somatic symptoms, stomach aches and headaches. Her anxiety is severely elevated. She's shown a preoccupation with clothing, grooming, and weight. Sort of typical around that age, but she's a little bit on the young side. She's only 10. 14, 15-year-old girls, much more likely for this. Neither Traci nor her mom is overweight, but Traci's mother reports her daughter has been picking at her food, refusing to eat certain food because she does not want to get fat. She appears tall for her age, and her weight seems proportionate to her height, but her mother reports she has not gained any weight in the last 6 months. Red flags. These are big, big red flags. Traci sees her father, stepmother, and stepsisters weekly. She reports she enjoys these visits. Her mother states that at times Traci has told her she prefers not to visit her father's home. So my question is really, is something going on in either home, and or is something going on with any of the friends at home and or at school? So I'd be wanting to know a lot more as far as those areas go. As far as diagnosis, she would meet other specified feeding or eating disorder / atypical anorexia nervosa. We don't have enough information just to go with anorexia, but that would be something to look at. With a person with anorexia, you want to make a psychiatric referral. I've had a couple folks say no to that because of her age. However, you do always want to do a psychiatric referral for anyone with an eating disorder. An SSRI is going to make them hungry, and it's going to target their depression, and it's going to make them feel a lot better. So typically psychiatry is pretty warranted, and you want to do this quickly. So within the past 6 months, she hasn't gained any weight, and she's 10. This can cause significant problems. So you want to make a report quickly. And you want to see if you can get her into a child psychiatrist pretty quickly. Once again, I'd look at abuse and bullying, and then I would go with the other specified feeding or eating disorder, atypical anorexia nervosa. Some of you diagnosed depressive disorders. It actually really falls under the atypical anorexia, but that would be something to really look at and see whether or not she actually meets criteria for a depressive disorder as well. Now, as far as psychiatric referrals, Frederick, you'd be making a psychiatric referral to immediately because he's having such intense delusions. Getting him on an antipsychotic is essential to really doing some good treatment. Okay, take care. Thanks.